Question 1. A behavior analyst is designing an intervention for a child who engages in frequent screaming in the classroom. The screaming occurs primarily when the child is presented with difficult academic tasks. A functional assessment indicates the screaming is maintained by escape from the task. Which intervention strategy is most directly suggested by this functional assessment outcome? A. Providing tangible rewards for quiet behavior. B. Implementing a response cost procedure for screaming. C. Modifying the difficulty of academic tasks or providing necessary supports. D. Providing attention contingent on quiet hands. Answer: C. Modifying the difficulty of academic tasks or providing necessary supports. This question tests your understanding of function-based interventions, specifically for escape-maintained behavior. The keyword maintained by escape is the crucial clue, indicating the behavior serves the purpose of avoiding something unpleasant. Therefore, the most effective intervention directly addresses the escape function, which involves altering the aversive situation, the difficult task, rather than using unrelated consequences like rewards or punishment. For instance, if the tasks are too hard, making them easier or providing help removes the need for screaming to escape. Remember, interventions should match the function of the behavior. If it's escape, change what they're escaping from. Question 2. A behavior analyst is conducting a study to evaluate the effectiveness of a new teaching method. They collect baseline data on the target skill, then introduce the new teaching method and observe an increase in the skill. To demonstrate a functional relation, the analyst then returns to baseline conditions and observes a decrease in the skill, followed by reintroducing the intervention and observing an increase. What experimental design is being used? A. Multiple baseline design. B. Changing criterion design. C. Reversal (ABAB) design. D. Alternating treatments design. Answer: C. Reversal (ABAB) design. This question describes the core components of a reversal design, also known as an ABAB design. The process involves collecting baseline data, A. Introducing the intervention, B. Returning to baseline, A. And reintroducing the intervention, B. The key clues are returns to baseline conditions and the sequence of introducing and removing the intervention. This design is used to demonstrate a functional relation by showing that the behavior changes systematically with the introduction and removal of the intervention. For example, you might measure tantrum frequency. A. Then use a reinforcement strategy. B. See tantrums decrease, remove the strategy. A. See tantrums increase, then reintroduce the strategy. B. And see tantrums decrease again. Remember, the reversal design is all about demonstrating control by turning the behavior on and off with the intervention. Question 3. A client typically engages in hand flapping when they are excited. The behavior analyst decides to implement a differential reinforcement of incompatible behavior, DRI, procedure, which intervention involves reinforcing a behavior that is incompatible with hand flapping. A. Reinforcing periods of time when hand flapping does not occur. B. Reinforcing the client for holding a toy or squeezing their hands. C. Reinforcing the client for completing a task without hand flapping. D. Providing a brief timeout contingent on hand flapping. Answer: B. Reinforcing the client for holding a toy or squeezing their hands. This question tests your knowledge of differential reinforcement procedures, specifically DRI. The keyword incompatible behavior means you are reinforcing a behavior that cannot happen at the same time as the target behavior, hand flapping. Holding a toy or squeezing hands makes it physically impossible to flap hands simultaneously. Options like reinforcing the absence of the behavior, DRO, or reinforcing a different behavior that isn't necessarily incompatible, DRA, or punishing the behavior are not DRI, For example, if a child rocks excessively, reinforcing them for sitting on their hands is DRI, because they cannot rock while sitting on their hands. Remember, incompatible means physically impossible to do both at once. Question 4. A behavior analyst is supervising a student who is providing direct services. The student expresses discomfort implementing a specific procedure because it conflicts with their personal values. According to the Professional and Ethical Code, what should the behavior analyst's primary consideration be? A. The student's personal values and comfort level. B. The potential impact of the procedure on the client's well-being and best interests. C. The potential for the student to find another supervisor. D. Ensuring the procedure aligns with the funding source requirements. Answer. B. The potential impact of the procedure on the client's well-being and best interests. This ethical question highlights the principle of prioritizing the client's welfare, which is a cornerstone of the BCBA Ethics Code. While considering the student's feelings is important in supervision, the primary ethical obligation is always to the client's safety, dignity, and effective treatment. The keyword primary consideration directs you to the most important ethical duty in a dilemma involving a student's discomfort. The analyst must ensure that the intervention is ethically sound and in the client's best interest, and if there's a conflict, the client's needs take precedence, requiring further discussion, modification, or assignment changes if necessary. For example, if a procedure involves brief, justified physical guidance, but the student is uncomfortable due to past trauma, the supervisor must ensure the procedure is truly necessary for the client's safety or learning, and then determine if the student can implement it safely and effectively, or if someone else should. Remember, the client's best interest is paramount in all ethical considerations. Question 5. During a functional analysis, a behavior analyst implements a condition where the target behavior results in the removal of a demand. If the behavior occurs at a high rate, specifically in this condition, what function is likely maintaining the behavior? A. Attention. B. Access to tangibles. C. Escape. D. Automatic reinforcement. Answer. C. Escape. This question describes a functional analysis condition designed to test the escape function. The key clue is that the behavior results in removal of a demand, which is the definition of negative reinforcement through escape. If the behavior happens more when engaging in it leads to getting out of something undesired, the function is likely escape. For example, if a child is presented with math problems and hitting their head results in the teacher removing the math problems, and this hitting happens mostly during math, it's likely escape maintained. Remember, if the behavior gets them out of something, it's escape. Question 6. A behavior analyst is working with a client on riding a bike. The analyst provides reinforcement for increasingly closer approximations to independent riding. First sitting on the bike, then pushing off with feet, then pedaling a short distance, and finally riding independently. What behavioral procedure is being used? A. Chaining. B. Shaping. C. Discrimination training. D. Modeling. Answer. B. Shaping. This question describes the procedure of shaping, which involves differentially reinforcing successive approximations to a terminal behavior. The key phrases are increasingly closer approximations and reinforcing steps towards the final skill. Instead of waiting for the full complex behavior to occur, you reinforce smaller, easier behaviors that are part of the skill, gradually requiring more accurate versions. For instance, teaching a dog to fetch involves reinforcing sniffing the toy, then touching it, then picking it up, then bringing it partway, then bringing it all the way back. Remember, shaping is like sculpting behavior by rewarding small steps that get closer and closer to the final form. Question 7. A child frequently grabs toys from peers. The behavior analyst implements an intervention where every time the child grabs a toy, they must give back the toy and also give a different preferred toy from their own collection to the peer. What is this procedure an example of? A. Response cost. B. Overcorrection. Restitutional. C. Overcorrection, positive practice. D. Timeout. Answer B. Overcorrection, restitutional. This question describes a form of overcorrection, specifically restitutional overcorrection. The key clues are that the child must not only return the toy, which restores the environment to its original state, but also make it better than it was before by giving another toy. Restitutional overcorrection requires the individual to repair the damage caused by the behavior, and then some. Positive practice overcorrection would involve repeatedly practicing a correct or incompatible behavior. For example, if a child spills juice, restitutional overcorrection might involve cleaning up the spill and then wiping down the entire table. Remember, restitutional overcorrection makes things better than they were before the behavior happened. Question 8. A behavior analyst is conducting a session with the client. When the analyst says, "Touch your nose," the client touches their nose. When the analyst says, "Touch your head," the client touches their head. The analyst reinforces both responses. This is an example of strengthening the client's behavior under the control of specific verbal stimuli. What concept is being demonstrated? A. Generalization. B. Discrimination. C. Extinction. D. Prompt fading. Answer B. Discrimination. This question illustrates discrimination, which is when an organism responds differently to different stimuli. The client touches their nose only when "touch your nose" is said and touches their head only when "touch your head" is said. The key is the differential response to different verbal prompts. The client is discriminating between the two instructions. For example, a dog that sits when you say "sit," but not when you say "stand" is discriminating between the commands. Remember, discrimination is responding correctly to one stimulus while not responding to another. Question 9. A behavior analyst is working with a client who engages in self-injurious behavior, SIB, maintained by automatic reinforcement. The analyst implements a procedure where the client is provided with access to highly preferred sensory stimuli whenever SIB occurs, making the SIB less effective as a source of stimulation. What type of intervention is this? A. Non-contingent reinforcement. NCR. B. Differential reinforcement of alternative behavior, DRA. C. Sensory extinction. D. Competing stimulus assessment. Answer C. Sensory extinction. This question describes sensory extinction, which involves masking or removing the sensory consequence of a behavior maintained by automatic reinforcement. The keyword "maintained by automatic reinforcement" and the description of providing competing sensory stimuli to make the SIB less effective points to this concept. Sensory extinction doesn't involve manipulating social consequences. It directly alters the sensory feedback loop. For example, putting gloves on a child who scratches themselves, automatically reinforced, could be a form of sensory extinction because it removes the tactile sensation of scratching the skin. Remember, sensory extinction directly targets the sensory feedback loop of automatically reinforced behavior. Question 10. A behavior analyst is collecting data on a client's hitting behavior. They define hitting as forceful contact of the client's hand or fist with another person's body. During a 10-minute observation, the client hits 5 times. The analyst records 5. What dimension of behavior is the analyst measuring? A. Latency. B. Duration. C. Frequency. D. Interresponse time, IRT. Answer C. Frequency. This question asks about the dimension of behavior being measured and provides clues about how the data is collected. The analyst is counting the number of times the behavior occurs within a specified time period, 5 times in 10 minutes, which is the definition of frequency, or rate when the time is included. The keyword is recording 5 occurrences. Latency is the time between the SD and the response, duration is how long the behavior lasts, and IRT is the time between responses. For instance, if you counted how many times a student called out in a class period, you would be measuring the frequency of calling out. Remember, frequency is simply a count of how many times the behavior happens. Question 11. A behavior analyst is developing a behavior support plan for a client with severe problem behavior. They determine that positive punishment may be necessary due to the behavior's intensity and risk. According to ethical guidelines, what must the behavior analyst ensure before implementing a punishment procedure? A. Less intrusive procedures have been attempted and documented as ineffective. B. The client has provided written consent for the procedure. C. The procedure is included in the client's individualized education plan, IEP. D. The procedure is approved by a Human Rights Committee only. Answer: A. Less intrusive procedures have been attempted and documented as ineffective. This ethical question addresses the hierarchy of restrictive interventions. The ethical code requires that less intrusive, function-based interventions be attempted and proven ineffective before resorting to more restrictive procedures like punishment. The key clue is the consideration of positive punishment for severe behavior, which triggers the requirement to demonstrate necessity by first trying less intrusive methods. Client consent and IEP inclusion are important, but are not the initial ethical hurdle regarding why punishment might be considered. The primary ethical consideration is using the least restrictive effective intervention. For example, if extinction and reinforcement of alternative behaviors haven't reduced dangerous headbanging, a behavior analyst might then consider punishment, but only after documenting the failure of the less restrictive methods. Remember, always try positive, less intrusive methods first before considering punishment. Question 12. A behavior analyst is teaching a client to follow multi-step instructions for completing daily routines, like washing dishes. The analyst breaks down the task into smaller steps: scrape plates, rinse plates, load dishwasher, etc., and teaches the steps in order, reinforcing each step completion. What instructional procedure is being used? A. Shaping. B. Discrimination training. C. Behavior chaining. D. Generalization training. Answer: C. Behavior chaining. This question describes behavior chaining, which involves breaking a complex skill into smaller, manageable steps, a task analysis, and teaching the sequence of these steps. The keywords breaks down the task into smaller steps, and teaching the steps in order point directly to this procedure. Shaping focuses on gradually modifying a single response, while chaining focuses on sequencing multiple discrete responses. For example, teaching someone to tie their shoes involves a chain of steps: pick up laces, cross laces, loop one over, pull tight, etc. Remember, chaining is about putting together a sequence of behaviors to complete a larger task. Question 13. A behavior analyst is designing a preference assessment for a child who has limited motor skills and cannot easily select items by touching them. Which type of preference assessment might be most suitable? A. Paired stimulus assessment. B. Multiple stimulus without replacement, MSWO, assessment. C. Free operant observation. D. Stimulus preference assessment using eye gaze or vocalizations as indicators. Answer: D. Stimulus preference assessment using eye gaze or vocalizations as indicators. This question requires you to consider how client characteristics might influence assessment methods. The key clue is limited motor skills, which makes traditional selection methods, like touching items, difficult. Therefore, a preference assessment needs to rely on alternative indicators like eye gaze, vocalizations, or approach behaviors that don't require fine motor skills, while other assessments, paired stimulus, MSWO, can be adapted. Using alternative indicators is the most direct solution mentioned for accommodating limited motor skills. For example, if a child can only look at preferred items, the analyst can track which items the child looks at or looks towards most often. Remember, preference assessments should be adapted to the individual client's abilities. Question 14. A behavior analyst is reviewing a graph showing a client's hitting behavior. The graph shows data points connected by lines, and the y-axis is labeled number of hits per 10-minute session. The x-axis is labeled sessions. This is a standard visual display for behavioral data. What is the primary advantage of using graphs in behavior analysis? A. They provide subjective interpretations of data. B. They allow for immediate and continuous evaluation of data. C. They replace the need for operational definitions. D. They obscure trends in the data. Answer: B. They allow for immediate and continuous evaluation of data. This question asks about the primary purpose and benefit of using graphs in behavior analysis. Graphs provide a visual representation of behavior over time, allowing behavior analysts to quickly and easily see trends, levels, and variability in the data as it is collected. The keyword advantage and the description of standard graphs highlight their role in data analysis. Graphs facilitate objective evaluation, do not replace operational definitions, and are specifically designed to reveal, not obscure, trends. For instance, looking at a graph can quickly show if an intervention is decreasing problem behavior or increasing a skill. Remember, graphs are essential tools for seeing if your intervention is working in real time. Question 15. A behavior analyst is consulting with a school team about a student's disruptive behavior. The team suggests using a token economy system. The behavior analyst explains that a token economy is a form of A. Negative punishment. B. Unconditioned reinforcement. C. Generalized conditioned reinforcement. D. Automatic reinforcement. Answer: C. Generalized conditioned reinforcement. This question asks you to classify a token economy within the framework of reinforcement. Tokens in a token economy become reinforcing because they are paired with a variety of other backup reinforcers, like snacks, free time, toys. Because tokens can be exchanged for many different things, and their value is not tied to a single establishing operation, they function as generalized conditioned reinforcers. Unconditioned reinforcers are primary needs, food, water, and punishment is about decreasing behavior, not increasing it through a system of earned rewards. For example, earning stars in a classroom that can be traded for different privileges makes the stars generalized conditioned reinforcers. Remember, token economies use generalized conditioned reinforcers because the tokens can buy many different things. Question 16. A behavior analyst is teaching a child to wash their hands. The analyst provides the prompt, "Wash your hands," and guides the child's hands through the entire process. Over successive trials, the analyst uses less physical guidance, then models the steps, then uses verbal prompts, and finally just gives the initial instruction. What process is the analyst using? A. Fading. B. Shaping. C. Chaining. D. Discrimination training. Answer: A. Fading. This question describes the process of prompt fading. The key clue is that the analyst starts with a strong prompt, full physical guidance, and gradually reduces the level of assistance across trials until the client responds to the natural stimulus, the instruction, "Wash your hands." Fading is the systematic removal of prompts to transfer stimulus control to the natural antecedent. Shaping changes the behavior itself, chaining links behaviors, and discrimination training teaches different responses to different stimuli. For example, if you teach a child to write their name by first tracing it, then copying it, then writing it independently, you are fading the tracing prompt. Remember, fading is like gradually removing scaffolding as a building is being built. Question 17. Which philosophical assumption of behavior analysis states that the universe is a lawful and orderly place, and all phenomena occur as a result of other events? A. Parsimony. B. Empiricism. C. Determinism. D. Pragmatism. Answer: C. Determinism. This question directly asks for the philosophical assumption that posits that events do not happen randomly but are caused by other events. The keywords lawful and orderly place, and all phenomena occur as a result of other events, are the definition of determinism. Parsimony favors the simplest explanation, empiricism relies on objective observation, and pragmatism focuses on practical effects. For example, a determinist views problem behavior not as random, but as a result of specific learning histories and environmental conditions. Remember, determinism means everything happens for a reason, and we can discover those reasons. Question 18. A behavior analyst is working with a client who engages in repetitive vocalizations, example, saying the same phrase over and over, that do not appear to be for attention, tangibles, or escape. The behavior occurs even when the client is alone. What function is most likely maintaining this behavior? A. Attention. B. Escape. C. Access to tangibles. D. Automatic reinforcement. Answer D. Automatic reinforcement. This question describes characteristics often associated with behavior maintained by automatic reinforcement. The key clues are that the behavior is repetitive and occurs when the client is alone, do not appear to be for attention, tangibles, or escape, and occurs even when the client is alone. This suggests the reinforcement is a direct result of the behavior itself, without requiring mediation by another person or external event. For example, hand flapping might produce a visual stimulus that is automatically reinforcing, or vocalizations might create an auditory stimulus. Remember, automatic reinforcement means the behavior produces its own reinforcement, like feeling good after scratching an itch. Question 19. A behavior analyst is measuring the time from when a teacher says, "Please clean up," to when the student picks up the first toy. What dimension of behavior is being measured? A. Duration. B. Frequency. C. Latency. D. Interresponse time. IRT. Answer C. Latency. This question asks about a specific dimension of behavior measurement. Latency is defined as the time between the presentation of a stimulus, the SD, "please clean up," and the start of the response, picking up the first toy. The key phrase time from when a teacher says, "Please clean up," to when the student picks up the first toy precisely describes latency. Duration is the length of the response, frequency is the count of the response, and IRT is the time between consecutive responses. For example, if the teacher says, "Sit down," and it takes 10 seconds for the child to begin sitting, the latency is 10 seconds. Remember, latency is the get-started time. Question 20. A researcher is comparing the effectiveness of two different reading interventions. Group A receives intervention 1, and Group B receives intervention 2. Both groups' reading skills are measured before and after the intervention. This type of comparison study is most vulnerable to threats to internal validity, such as subject variability between groups, unless participants were randomly assigned. What type of experimental design is this describing? A. Withdrawal design. B. Multiple baseline design. C. Group experimental design, example pre-test/post-test with control group. D. Alternating treatments design. Answer C. Group experimental design, example pre-test/post-test with control group. This question describes a typical group experimental design used in research, often involving comparing outcomes between different groups who receive different treatments or treatment versus a control condition. The key clues are comparing the effectiveness of two different reading interventions, using Group A and Group B, and measuring outcomes before and after. This is distinct from single subject designs, withdrawal, multiple baseline, alternating treatments, which focus on individual behavior change. Group designs often face challenges with internal validity due to potential differences between the groups before the intervention starts, even with random assignment. For example, comparing the test scores of one class using a new math curriculum versus another class using the old curriculum is a group design. Remember, group designs compare averages between different groups of people. Question 21. A client screams loudly to gain attention from the therapist. The therapist decides to implement extinction by ignoring the screaming. Initially, the screaming increases in both frequency and intensity before it starts to decrease. What is this temporary increase in the behavior called? A. Spontaneous recovery. B. Response generalization. C. Extinction burst. D. Behavioral contrast. Answer C. Extinction burst. This question describes a common phenomenon that occurs when an extinction procedure is first implemented. The key clues are that the behavior, screaming, increases in both frequency and intensity before it starts to decrease immediately after extinction. Ignoring begins. This temporary increase is known as an extinction burst, as the individual tries harder to evoke the previously effective consequence. Spontaneous recovery is the reappearance of a behavior after it has been extinguished. Response generalization is performing variations of the behavior, and behavioral contrast is a change in behavior rate in one setting due to a change in reinforcement in another setting. For example, if you stop putting money in a vending machine that used to work, you might press the button harder or multiple times initially before giving up. That's an extinction burst. Remember, an extinction burst is like a final push before the behavior gives up. Question 22. A behavior analyst is asked to develop goals for a client. The goals should be measurable, observable, and clearly defined. Which of the following is the best example of a well-written, observable, and measurable goal? A. Johnny will be happy during sessions. B. Johnny will decrease his aggression. C. Johnny will make good choices. D. Johnny will raise his hand and wait to be called on before speaking for 80% of opportunities during group activities. Answer: D. Johnny will raise his hand and wait to be called on before speaking for 80% of opportunities during group activities. This question asks you to identify a well-defined behavioral goal, which must be observable and measurable. Options A, B, and C use subjective terms like happy, decrease his aggression, without specifying how measured or to what extent, and good choices, undefined. Option provides a specific, observable behavior, raise his hand and wait to be called on, and a clear measurement criterion. 80% of opportunities during group activities. This allows for objective data collection to track progress. For example, instead of saying learn to be polite, a well-written goal might be Sarah will say please and thank you when requesting or receiving items on 90% of opportunities. Remember, good goals are semi-art: specific, measurable, achievable, relevant, and time-bound. Though the time component isn't always explicit in short examples, the other elements are crucial. Question 23. A behavior analyst is teaching a child to say cookie when they want a cookie. The analyst holds up a cookie, prompts the child to say cookie, and provides the cookie after the child says it. The child is learning to request the cookie. This is an example of teaching which verbal operant? A. Tact. B. Etroic. C. Intraverbal. D. Mand. Answer: D. Mand. This question describes the teaching of a mand, which is a verbal operant under the control of a motivating operation, MO, and is reinforced by the specific item or event requested. The key clues are the child wants a cookie, indicating an MO, and the response, cookie, results in receiving the cookie, specific reinforcement. This behavior is a request. A tact is labeling something in the environment, an echoic is repeating something said, and an intraverbal is responding to someone else's verbal behavior, like answering a question. For example, saying water because you are thirsty and receiving water is a mand. Remember, a mand is essentially asking for what you want. Question 24. A behavior analyst is implementing a token economy. Tokens are delivered immediately after the target behavior occurs. The tokens can be exchanged later for various preferred items and activities. The immediacy of the token delivery is important because A. It prevents satiation on the backup reinforcers. B. It strengthens the connection between the target behavior and the conditioned reinforcer, the token. C. It allows for easier data collection. D. It is required by most funding sources. Answer B. It strengthens the connection between the target behavior and the conditioned reinforcer, the token. This question asks why immediate reinforcement is important, specifically in the context of a token economy, where the token is the immediate consequence. Immediacy is a critical factor in the effectiveness of reinforcement because it helps the learner associate the behavior with the consequence. Delivering the token right after the behavior makes it clear which behavior earned the token, helping the token become a strong conditioned reinforcer. While delaying gratification is a skill for initial learning and maintaining the reinforcing value of the token, immediate delivery is standard practice. For example, if a teacher gives a student a sticker right after they raise their hand, the student quickly learns raising their hand earns stickers. If the sticker is given much later, the connection is weaker. Remember, immediate reinforcement helps the learner understand exactly what behavior is being rewarded. Question 25. A behavior analyst is reviewing data on a client's task completion. The data show high variability from session to session. What is the most appropriate immediate action the behavior analyst should take? A. Discontinue the intervention as it is ineffective. B. Conduct a functional analysis immediately. C. Look for variables in the environment or implementation that might be influencing the behavior. D. Change to a different measurement system. Answer C. Look for variables in the environment or implementation that might be influencing the behavior. This question addresses how to interpret and respond to data variability, a common challenge in behavior analysis. High variability suggests that uncontrolled factors are influencing the behavior. The most appropriate first step is to investigate these factors, such as inconsistent prompting, changes in setting, or variations in reinforcement delivery. The keywords are high variability. Discontinuing the intervention is premature without understanding the variability. A functional analysis might be a next step, but investigation of current variables comes first, and changing the measurement system won't fix actual variability in the behavior. For example, if a child's compliance varies wildly, the analyst might check if different staff are prompting differently or if the child's sleep schedule is inconsistent. Remember, when data jumps around, look for what else is jumping around in the environment or how the plan is being carried out. Question 26. Which schedule of reinforcement is most likely to produce a high, steady rate of responding with a slight pause after reinforcement? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer B. Variable ratio, VR. This question asks about the characteristic response pattern produced by a specific schedule of reinforcement. A variable ratio schedule provides reinforcement after a variable number of responses. This unpredictability maintains a high, steady rate of responding because the learner knows reinforcement is coming after a certain number of responses, but they don't know exactly when, so they keep responding quickly. The slight pause after reinforcement mentioned in some definitions is more characteristic of FR, but VR is known for the high, steady rate. Fixed schedules, FR, FI, tend to produce post-reinforcement pauses, and interval schedules, FI, VI, produce lower rates overall than ratio schedules. For example, gambling on a slot machine is on a VR schedule. The more times you pull the lever, response, the more chances you have to win, reinforcement, but you don't know exactly how many pulls it will take. Remember, VR schedules are like gambling. You never know exactly when you'll win, so you keep going fast. Question 27. A behavior analyst is providing supervision to a new supervisee. The supervisee has limited experience but is eager to learn. According to the ethical code, what level of supervision intensity is typically required for supervisees acquiring new skills? A. Weekly supervision is sufficient regardless of skill level. B. Supervision intensity should match the supervisee's training, experience, and the complexity of the cases. C. Daily supervision is always required for new supervisees. D. Supervision is only required if the supervisee requests it. Answer. B. Supervision intensity should match the supervisee's training, experience, and the complexity of the cases. This ethical question pertains to the responsibilities of supervisors. The ethical code emphasizes that supervision must be individualized based on the supervisee's needs and the nature of their work. The keywords limited experience but is eager to learn and acquiring new skills suggest a need for more intensive supervision, but the exact level is determined by assessing their specific competencies and the difficulty of their cases. A fixed weekly schedule isn't always sufficient. Daily might be excessive unless cases are highly complex or the supervisee is struggling significantly and supervision is a requirement, not optional. For example, a supervisee working with a complex, dangerous behavior needs more frequent and intensive supervision than one working on simple skill acquisition with a compliant client. Remember, supervision isn't one size fits all. It should fit the supervisee and the job. Question 28. A child is taught to label pictures of animals. Example, sees a picture of a dog, says dog. Later, without direct training, the child sees a real dog and says dog. What behavioral concept is demonstrated? A. Response generalization. B. Stimulus generalization. C. Maintenance. D. Discrimination. Answer. B. Stimulus generalization. This question describes stimulus generalization, which occurs when a learned behavior happens in the presence of stimuli that are similar to the original training stimulus but were not specifically trained. The key clue is that the child learned to respond to a picture of a dog, but then responded similarly to a real dog, which is a different but related stimulus. The response, dog, is the same, but the stimulus, picture vs. real dog, is different. Response generalization would be saying puppy or hound when seeing the picture. For example, a child taught to say car when they see their parents' car might also say car when they see a neighbor's similar car. Remember, stimulus generalization means the behavior happens in new, similar situations. Question 29. A behavior analyst is reviewing a target behavior defined as aggression. Any instance of hitting, kicking, or biting another person. What potential issue exists with this operational definition? A. It is too narrow and might miss instances of aggression. B. It is too broad and includes non-aggressive behaviors. C. It is objective and measurable, with no apparent issues. D. It does not specify the force or intensity required. Answer. D. It does not specify the force or intensity required. This question asks you to evaluate the quality of an operational definition, specifically for a behavior like aggression, while hitting, kicking, or biting another person identifies the form of the behavior. A complete operational definition needs to be objective and measurable enough that two observers would agree on whether it happened. Aggression definitions often require a criterion for force or intensity. Example, forceful contact resulting in a mark. Kicking causing a visible reaction from the other person, because not all physical contact constitutes aggression. The lack of this criterion is a common issue. For example, a light tap versus a hard hit would both count under the provided definition, which might not be the clinical target. Remember, operational definitions need enough detail that anyone observing can consistently identify the behavior. Question 30. A behavior analyst is implementing a procedure where, for a brief period of time, the client does not have access to reinforcement contingent on the occurrence of problem behavior. The client is typically removed from the reinforcing environment and placed in a separate area. What type of punishment procedure is being used? A. Response cost. B. Positive punishment. C. Timeout from positive reinforcement. D. Overcorrection. Answer. C. Timeout from positive reinforcement. This question describes timeout from positive reinforcement, a type of negative punishment. The key clues are that the client is removed from access to reinforcement, does not have access to reinforcement for a brief period, and placed in a separate area contingent on problem behavior, with the intent of decreasing the behavior. Response cost involves removing a specific reinforcer, like tokens. Positive punishment involves adding an aversive stimulus, and overcorrection involves requiring effortful behavior related to the infraction. For example, sending a child to a thinking corner where they cannot access toys or attention after hitting a sibling is a form of timeout. Remember, timeout means temporarily removing access to reinforcement. Question 31. A behavior analyst is teaching a client to follow the instruction, point to the object. The analyst presents an array of pictures and says, point to the car. The client points to the truck. The analyst says, no, that's a truck, and represents the array. This trial is considered A. A prompted trial. B. A correct trial. C. An incorrect trial. D. An intertrial interval. Answer: C. An incorrect trial. This question tests your understanding of trial-based instruction and data collection. The client is presented with a stimulus, the instruction point to the car, and makes a response, points to the truck. Since the response does not match the requested target, car, it is classified as an incorrect trial. A prompted trial involves giving a prompt before the response to help the client respond correctly. A correct trial is when the response matches the requested target. The intertrial interval is the time between trials. For example, if teaching colors and you say, touch blue, and the child touches red, that's an incorrect trial. Remember, an incorrect trial is when the client doesn't do the target behavior asked by the instruction. Question 32. A behavior analyst is consulting with a parent about increasing a child's compliance with bedtime routines. The parent reports that the child is very difficult at bedtime and screams and cries when told to get ready. The behavior analyst asks the parent what usually happens after the screaming and crying starts. By asking about the consequence, the analyst is gathering information to determine the behaviors. A. Form. B. Function. C. Topography. D. Intensity. Answer: B. Function. This question highlights a core component of functional assessment, identifying the function or purpose of a behavior. Asking what happens after the behavior occurs, the consequence, is a key strategy for understanding what is maintaining the behavior. The keyword "what usually happens after" directly relates to assessing the outcome of the behavior from the child's perspective. Form and topography refer to the physical appearance of the behavior, screaming, crying, and intensity is how hard or loud the behavior is. Understanding function allows the analyst to design effective, function-based interventions. For example, if the parent says the child is allowed to stay up later after screaming, the function is likely escape from bedtime. Remember, asking what happens after the behavior helps you figure out why the behavior is happening. Question 33. A behavior analyst is observing a client's tantrum behavior. The analyst records the tantrum as occurring if crying, screaming, or throwing objects happens at any point during a 1-minute interval. What type of discontinuous measurement is the analyst using? A. Whole interval recording. B. Partial interval recording. C. Momentary time sampling. D. Duration recording. Answer: B. Partial interval recording. This question describes partial interval recording, a discontinuous measurement method. The key clue is that the behavior is recorded if it occurs at any point during a 1-minute interval. With partial interval, the observer scores the interval if the behavior happens for even a brief moment within that interval. Whole interval requires the behavior to occur throughout the entire interval, and momentary time sampling requires the behavior to occur only at the very end of the interval. Duration recording measures how long the behavior lasts, which is continuous measurement. For example, if you're using partial interval recording 2-track hand raising and a child raises their hand for 5 seconds during a 1-minute interval, you would mark that interval as having hand raising. Remember, partial interval overestimates continuous behavior because you score the whole interval even if the behavior was brief. Question 34. According to Skinner's analysis of verbal behavior, saying "that's a dog" when seeing a dog is an example of which verbal operant? A. Mand. B. Tact. C. Intraverbal. D. Echoic. Answer: B. Tact. This question asks about the classification of a specific verbal behavior according to B. F. Skinner, saying "that's a dog" when you see a dog is attacked because the verbal response is under the control of a nonverbal stimulus in the environment. Seeing the dog and is reinforced socially. Example, the listener agrees. The key clue is seeing the object first and then labeling it. A mand is requesting something. An intraverbal is a response to someone else's verbal behavior, like answering a question. And an echoic is repeating what someone else said. For example, pointing to a bird and saying "bird is attacked." Remember, attacked is like labeling something you see, hear, smell, taste, or feel. Question 35. A behavior analyst is teaching a child to appropriately request a break when feeling frustrated instead of engaging in aggression. The analyst reinforces the child for saying "I need a break" when presented with a difficult task and places aggression on extinction. If aggression occurs, what type of differential reinforcement procedure is being used? A. DRO. Differential reinforcement of other behavior. B. DDRI. Differential reinforcement of incompatible behavior. C. DRA. Differential reinforcement of alternative behavior. D. DRL. Differential reinforcement of low rates. Answer: C. DRA. Differential reinforcement of alternative behavior. This question describes differential reinforcement of alternative behavior, DRA. The key clues are that the analyst is reinforcing a specific, appropriate alternative behavior, request a break, while simultaneously withholding reinforcement for the problem behavior, aggression. The alternative behavior, asking for a break, is not necessarily physically incompatible with aggression, like DRI would require, but it is a desired replacement behavior. DRO reinforces the absence of the behavior, and ERL reinforces the behavior occurring at a lower rate. For example, reinforcing a student for raising their hand to ask a question while ignoring calling out is DRA. Remember, DRA teaches and reinforces a different, better way to get the same, or similar, outcome as the problem behavior. Question 36. A behavior analyst is using a graph where the x-axis represents time example sessions, days, and the y-axis represents the value of the dependent variable, the behavior being measured. Data points are plotted to show the occurrence of the behavior over time. This is the most common type of graph used in ABA. What is this graph called? A. Histogram. B. Bar graph. C. Scatterplot. D. Line graph. Answer: D. Line graph. This question describes the standard cumulative record, which is essentially a line graph. The key clues are the axes representing time and the dependent variable, and data points being plotted to show change over time. Line graphs are the most common visual display in ABA single subject designs because they clearly show trends, levels, and variability in behavior across sessions or over time, which is critical for evaluating intervention effectiveness. Histograms and bar graphs are typically used to compare discrete sets of data or summarized data, and scatterplots show the relationship between two variables. For example, plotting the frequency of hand flapping across 20 therapy sessions uses a line graph. Remember, line graphs are the go-to for showing how behavior changes over time in ABA. Question 37. A behavior analyst is supervising a student who is implementing a new behavior plan. The student expresses uncertainty about how to correctly implement a procedure described in the plan. According to ethical guidelines, what is the supervisor's responsibility in this situation? A. Tell the student to figure it out by reading the plan. B. Observe the student implementing the procedure and provide feedback and training. C. Assume the student is competent because they are assigned to the case. D. Have the student ask another supervisee for help. Answer B. Observe the student implementing the procedure and provide feedback and training. This ethical question addresses the supervisor's responsibility to ensure competence in their supervisees. When a supervisee expresses uncertainty or demonstrates a lack of skill, the supervisor is ethically required to provide the necessary training, guidance, and direct observation to ensure the procedure is implemented correctly and safely. The key word is uncertainty about how to correctly implement. Leaving the student to figure it out, assuming competence, or directing them to peers are not ethically sound supervisory practices. For example, if a supervisee is unsure how to fade a prompt, the supervisor should model it, observe the supervisee trying it, and provide specific instructions and praise/correction. Remember, a supervisor's job includes actively teaching and ensuring supervisees can do their job right. Question 38. A behavior analyst is working with a client who frequently interrupts conversations. The analyst decides to use a schedule where the client is reinforced for interrupting no more than 3 times per 10-minute conversation. If they interrupt more than 3 times, they do not receive reinforcement for that interval. What schedule of reinforcement is being used? A. DGRL, differential reinforcement of low rates. B. DRH, differential reinforcement of high rates. C. DRD, differential reinforcement of diminishing rates. D. FI, fixed interval. Answer A. DRL, differential reinforcement of low rates. This question describes a differential reinforcement of low rates. DRL schedule. DRL is used when the goal is to reduce the rate of a behavior, but not necessarily eliminate it entirely. The key clue is reinforcing the behavior only when it occurs at or below a certain rate, no more than 3 times per 10-minute conversation. DRH reinforces high rates. DRD reinforces rates that are progressively lower over time, a variation of DRL. And FI is an interval schedule tied to time, not the number of responses within an interval. For example, reinforcing a child for calling out no more than once per lesson is a DRL procedure. Remember, DRL is used to make a behavior happen less often, but still allows it to happen occasionally. Question 39. A behavior analyst is assessing the reliability of data collected by 2 different observers on the same client's hitting behavior. Both observers used the same operational definition and measurement system, frequency count. The analyst calculates the percentage of intervals where both observers recorded the same count of hitting. What type of data reliability is being measured? A. Trial by trial IOA. B. Interval by interval IOA, or exact count IOA if using counts per interval. C. Total count IOA. D. Event recording IOA. Answer B. Interval by interval IOA, or exact count IOA if using counts per interval. This question asks about calculating inter-observer agreement, IOA, for frequency data collected within intervals. The key clue is calculating agreement based on percentage of intervals where both observers recorded the same count. This is a form of interval by interval IOA adapted for frequency within intervals, sometimes called exact count IOA per interval, where agreement is scored only if the counts within the interval match exactly. Total count IOA compares the total counts across the entire observation period, not interval by interval. Trial by trial is used for discrete trials, and event recording IOA is a broader term that could encompass several methods. For example, if observer 1 records 2 hits and observer 2 records 2 hits in the first minute interval, that's agreement for that interval. If in the second minute, observer 1 records 3 and observer 2 records 2, that's disagreement for that interval. Remember, interval by interval, or exact count. IOA for frequency looks at agreement for each small chunk of time. Question 40. A behavior analyst is conducting a functional behavior assessment, FBA. Which of the following is a direct assessment method used to gather information about the function of behavior? A. Interviews with parents and teachers. B. Review of existing records, example, incident reports. C. Conducting a scatterplot analysis of behavior occurrence. D. Conducting a functional analysis. Answer: D. Conducting a functional analysis. This question differentiates between direct and indirect FBA methods. A functional analysis is a direct assessment method because the behavior analyst directly manipulates antecedent and consequence variables in a controlled environment to test hypothesized functions and observes the effect on the behavior. Indirect assessments rely on reports from others, interviews, or historical data, record reviews, scatterplots which summarize existing data but don't involve direct manipulation. The keyword is direct assessment method. For example, setting up conditions where problem behavior leads to attention in one condition and escape in another allows the analyst to directly see which consequence maintains the behavior. Remember, direct assessment means the analyst is directly observing the behavior and the surrounding events as they happen, often under controlled conditions. Question 41. A behavior analyst is designing a program to teach a client to initiate social greetings. The analyst plans to fade in the number of people the client greets independently, starting with one familiar person, then two, then three, and so on. This systematic process of gradually changing a stimulus feature, number of people, is an example of A. Shaping. B. Stimulus generalization. C. Stimulus fading. D. Programmatic generalization. Answer: C. Stimulus fading. This question describes stimulus fading, which is the gradual change in the physical properties of a stimulus to transfer stimulus control from one stimulus to another. While this leads to generalization across people, the process described gradually increasing the number of people from 1 to 2 to 3 involves systematically changing the stimulus complex. The key clue is fade in the number of people, which means gradually presenting the target behavior opportunity with an increasing number of individuals. Shaping modifies the response. Stimulus generalization is an outcome where the behavior occurs with untrained stimuli, and programmatic generalization refers to planning for generalization within the intervention design. For example, teaching a child to identify words by gradually removing parts of a picture cue while the word is still present is stimulus fading. Remember, stimulus fading involves slowly changing the look or amount of something while keeping the response requirement the same. Question 42. According to the philosophical assumption of parsimony in behavior analysis. A. Behavior is determined by predictable factors. B. Explanations for behavior should be based on objective observation. C. The simplest explanation for a phenomenon should be considered first. D. Behavior should be studied through controlled experiments. Answer: C. The simplest explanation for a phenomenon should be considered first. This question asks about the principle of parsimony. Parsimony dictates that when multiple explanations for a phenomenon exist, the simplest explanation that accounts for all the data should be favored before considering more complex ones. The keyword is simplest explanation. Determinism is about lawful relations, empiricism is about objective observation, and experimentation is a method used in behavior analysis. For example, if a child's behavior increases after receiving attention, the parsimonious explanation is that attention functions as reinforcement, rather than inventing a complex internal state or personality trait. Remember, parsimony is about Occam's razor. The simplest answer is usually the right one until proven otherwise. Question 4.3. A behavior analyst implements an intervention where a client earns a token every time they complete a task independently. The client can exchange 10 tokens for 5 minutes of tablet time. The tablet time is functioning as A. conditioned punisher. B, unconditioned reinforcer. C, backup reinforcer. D, conditioned stimulus. Answer: C, backup reinforcer. This question is about the components of a token economy. In this system, the tokens are the immediate conditioned reinforcers that the client earns. The items or activities that the tokens can be exchanged for later, like tablet time, are called backup reinforcers because they back up the value of the tokens. The key clue is that the tablet time is accessed after collecting a certain number of tokens. An unconditioned reinforcer is naturally reinforcing, like food. A conditioned punisher decreases behavior, and a conditioned stimulus is a neutral stimulus that becomes associated with a response, often in classical conditioning. For example, in a classroom token economy, earning points, tokens that can be traded for extra playtime, backup reinforcer, illustrates this concept. Remember, backup reinforcers are the prize you cash in your tokens for. Question 44. A behavior analyst is measuring the rate of a client's verbal initiations, example, saying hi or asking a question. The analyst records the number of initiations per hour of observation. This measurement is a combination of which two dimensions of behavior? A, latency and duration. B, frequency and time. C, IRT and frequency. D, count and intensity. Answer: B, frequency and time. This question asks about the components of a rate measure. Rate is defined as the number of responses, frequency, occurring over a unit of time. The key clue is number of initiations per hour. This directly combines frequency, the count of initiations, with the time period over which they were counted, per hour. Latency is time to start, duration is length, and IRT is time between responses. Intensity is the force or magnitude of the behavior. For example, if a child says hi 12 times in a 30-minute session, the rate is 24 initiations per hour. Remember, rate is always a count divided by a time unit. Question 45. A behavior analyst is teaching a child to greet people. The analyst says, "Say hi," and the child says hi. The analyst provides reinforcement. This is an example of strengthening which verbal operant? A, mand. B, tact. C, intraverbal. D, echoic. Answer: D, echoic. This question describes an echoic, which is a verbal response that is controlled by and matches a verbal stimulus. The key clue is the analyst saying "say hi," verbal stimulus, and the child saying hi. Verbal response that is the same form. The child is repeating what was heard. A mand is asking for something. A tact is labeling something non-verbally present, and an intraverbal is responding to someone else's verbal behavior, like answering a question, where the response is different from the stimulus. For example, a child repeating "mama" after their mother says "mama" is an echoic. Remember, an echoic is simply repeating sounds or words you hear. Question 46. A behavior analyst is reviewing data from a study where an intervention was implemented. The data show a clear change in the desired direction only after the intervention was introduced. However, several uncontrolled events also occurred around the same time. The intervention started, example, client started new medication, changed schools. These uncontrolled events are examples of threats to A, measurement reliability. B, internal validity. C, external validity. D, treatment integrity. Answer: B, internal validity. This question addresses internal validity in experimental design. Internal validity refers to the extent to which you can confidently say that the intervention, and only the intervention, caused the observed change in behavior. Uncontrolled events occurring concurrently with the intervention are confounds that make it difficult to isolate the intervention as the cause. The key clue is that several uncontrolled events also occurred around the same time, making it hard to attribute the behavior change solely to the intervention. External validity is about generalizability, reliability is about consistency of measurement, and treatment integrity is about whether the intervention was implemented as planned. For example, if a reading program starts the same week a student gets glasses, it's hard to be sure if the reading improvement was due to the program or the glasses. That's a threat to internal validity. Remember, internal validity is about making sure your intervention was the only thing that likely caused the change. Question 47. A behavior analyst is developing a skill acquisition program for a client. The target skill is tying shoes. The analyst has identified all the individual steps required to tie shoes, example, picking up laces, crossing laces, making a loop. What is the term for this list of steps in order? A. Behavior chain. B. Task analysis. C. Skill repertoire. D. Operational definition. Answer B. Task analysis. This question asks for the specific term used for breaking down a complex skill into smaller sequential steps. A task analysis is the process of identifying and listing the component steps in a sequence required to perform a complex behavior. The key clue is identified all the individual steps required. This list of steps in order. A behavior chain is the sequence of behaviors that follows the task analysis. A skill repertoire is the collection of all skills a person has, and an operational definition describes a single behavior in measurable terms. For example, a task analysis for washing hands includes turning on water, wetting hands, getting soap, rubbing hands, rinsing, turning off water, drying hands. Remember, a task analysis is like a recipe or checklist for a complex skill. Question 48. According to the ethical code, when should a behavior analyst recommend that a client seek other services, example, medical, psychological? A. Only if the behavior analyst is unable to make progress with the client. B. When it is indicated that a medical, psychological, or other professional condition may be contributing to the client's behavior. C. Only if the client or their guardian specifically requests a referral. D. The behavior analyst should never recommend other services, as ABA is comprehensive. Answer B. When it is indicated that a medical, psychological, or other professional condition may be contributing to the client's behavior. This ethical question addresses the behavior analyst's responsibility to consider other potential contributing factors to a client's behavior and make appropriate referrals. The ethical code requires behavior analysts to recognize the limitations of their expertise and the potential influence of other variables on behavior. If there is an indication that a medical, psychological, or other condition might be playing a role, it is their responsibility to recommend consultation with or assessment by relevant professionals. The key clue is recognizing when other factors may be contributing. For example, if a child's sudden increase in aggression coincides with reports of headaches, the analyst should recommend a medical evaluation. Remember, behavior is complex, and sometimes other professionals need to be involved to rule out or address underlying issues. Question 49. A behavior analyst is using whole interval recording to measure a client's on-task behavior during class. The client is marked as on task for a 1-minute interval only if they remained on task for the entire 1 minute. What is a potential disadvantage of using whole interval recording for on-task behavior? A. It tends to overestimate the actual occurrence of the behavior. B. It tends to underestimate the actual occurrence of the behavior. C. It requires more observation time than other methods. D. It is difficult to calculate IOA with this method. Answer B. It tends to underestimate the actual occurrence of the behavior. This question asks about a potential limitation of whole interval recording. With whole interval recording, the behavior must occur continuously throughout the entire interval to be scored. If the client is on task for 59 seconds of a 60-second interval, but is off task for 1 second, that interval is scored as not on task. This method is likely to underestimate behaviors that occur frequently, but for short durations or that are not continuous, especially if the intervals are long. Partial interval overestimates and momentary time sampling can over or underestimate depending on the behavior pattern. IOA calculation is standard for whole interval, and observation time is similar to other interval methods. For example, if you used whole interval to measure reading, and the child paused briefly every minute to turn a page, you might score many intervals as not reading, even though they were mostly reading. Remember, whole interval requires the behavior to fill the whole time block, so it often misses brief instances. Question 50. A behavior analyst is observing a client during a break time. The client typically sits alone and engages in repetitive hand movements. The analyst wants to decrease the hand movements and increase interaction with peers. The analyst decides to provide reinforcement, praise, and access to preferred toys whenever the client interacts appropriately with peers and ignores the hand movements. What is the target behavior for reinforcement in this scenario? A. Repetitive hand movements. B. Sitting alone. C. Interaction with peers. D. Access to preferred toys. Answer: C. Interaction with peers. This question asks you to identify the specific behavior that the behavior analyst is reinforcing in the described intervention. The analyst is applying reinforcement whenever the client interacts appropriately with peers. This makes interaction with peers the target behavior for increase through reinforcement. Repetitive hand movements are the behavior targeted for decrease via extinction/ignoring. Sitting alone is a state, not a specific behavior being reinforced, and access to preferred toys is the reinforcer being used, not the behavior being strengthened. For example, if a teacher gives a student a sticker for sharing a toy, sharing is the target behavior for reinforcement. Remember, the target behavior for reinforcement is what you want to see more of after the intervention.